If you hear ringing, buzzing, hissing, or high-pitched tone that no one else can hear, this video is for you. You probably already know it's called tinnitus, and to many it's annoying, but to others it can be frightening and exhausting. And for some people it feels completely out of control. If you think you're the only one, check out these stats. Over 50 million Americans experience it, and around 2 million find it debilitating. Worldwide, it's estimated that 750 million people are affected, so you're not alone. But here's the one thing most people don't realize. Tinnitus can be evaluated. It can be measured. And for the majority of people, it can be managed, often successfully. Hi, I'm Matt Murphy, a retired audiologist with 20 years as a private practice owner and founder of earHero, the world's first micro speaker non-occluding earphone. I'm not here to sell you hearing aids. I'm here to help you understand what's happening in your auditory system and show you practical, realistic ways to reduce tinnitus and regain control. Today, we're going to cover what tinnitus actually is, the most common causes, how tinnitus is properly diagnosed using tinnitus matching, which I'll explain in detail, so stick around. Plus, I'm going to discuss the most effective treatment strategies, including sound therapy and stress-based approaches. When I was in audiology school 30 years ago, we called it tinnitus. But back then, many people confused the word with tendinitis. So we were taught to call it tinnitus. So you're going to hear me use this term. Let's start by clearing up a big misunderstanding. Tinnitus is not a disease. It's a symptom or a signal from the auditory system and the brain. Most of the time, tinnitus happens because the brain is no longer receiving the sound input it expects from the ears. When that input drops, the brain turns up the internal gain, and the result is a phantom sound. I would describe it to my patients like this. The brain is used to getting all the frequencies delivered from the hair cell, and when one or more frequencies is not delivering because of the damage at the ear level, the brain generates that sound for itself. And that sound is usually different for everybody, but it can be a single tone, ringing, buzzing, hissing, clicking, roaring, or even multiple sounds all packed together. And here's something important. The loudness of the tinnitus does not always equal the level of the damage. I have seen some people with mild hearing loss have severe tinnitus, and others with significant hearing loss barely even notice it. That's because tinnitus is as much a brain response as it is an ear issue. I personally have tinnitus and on occasion, so I understand what you're hearing. So let's talk about the most common reasons tinnitus develops. Probably the number one thing is hearing loss. And this is by far the most common reason. Even mild or hidden hearing loss can trigger tinnitus. This includes age-related hearing loss, noise exposure from work, concerts, firearms, or machinery, past noise trauma you may not remember. And as I mentioned, the brain fills in missing sound with those internal noises that usually are frequency specific. I can't tell you how many people I saw who had normal hearing but still had tinnitus. But that doesn't mean tinnitus isn't real. It often means the loss is subtle or not fully captured by a basic hearing test. The second is noise trauma. Being in Idaho, we saw a lot of hunters and shooters who came in after a day in the field with tinnitus. A single loud event or repeated exposure over time can damage inner hair cells. The damage may heal partially, but tinnitus can remain. This is very common in veterans, first responders, musicians, and concert goers, as well as factory and construction workers. The third thing that can affect tinnitus is stress and anxiety. Sometimes this one surprises people. It doesn't necessarily cause the tinnitus, but it can definitely amplify it. Stress activates the nervous system. That increases the awareness, and tinnitus becomes louder, sharper, and harder to ignore. This creates a vicious loop. You've got tinnitus and anxiety, and then more tinnitus, and then more anxiety. Breaking this loop is a major part of the treatment. Physical issues can also affect tinnitus, like jaw, neck, or muscle tension. If your tinnitus changes when you clench your jaw, turn your head, or press on your neck. These suggest a possible musculoskeletal component. This type of tinnitus often responds well to physical therapy, posture work, and relaxation. The fifth thing that can affect tinnitus is related to medical or medication factors. Being aware of your tinnitus when you change medications or have medical procedures can help you resolve the tinnitus quicker. Some of the less common things that could affect tinnitus are ear infections or wax blockage, blood pressure changes. Even certain medications are known to cause tinnitus or even hearing loss and need to be monitored, especially at high doses. These should always be ruled out by a professional. Now let's talk about something most people never experience, and it's called tinnitus matching. This is a way for your provider to measure your tinnitus. It's also, just so we're clear, it doesn't mean we fix it during the test. It just means we identify the characteristics which guides the treatment. So tinnitus matching is typically done after the hearing test is complete. During tinnitus matching, in our office, we would play tones or noise through headphones. Because the tinnitus is subjective and typically only heard by the patient, we would present different frequencies and ask the patient to identify which pitch was closest to what they were hearing. Once we found a pitch that was close to what they were hearing, we would adjust the volume up and down, ask the patient to approximate the level that matches their tinnitus. The goal was to find both the pitch of the tinnitus and the perceived loudness level. So you ask, why does this matter? Well, because tinnitus treatment is not one size fits all. Tinnitus matching helps us confirm the tinnitus is auditory based and identify which frequencies are involved, determine whether the sound therapy is likely to help, and customize sound generators or hearing aid settings. Many times in my practice, when I was dealing with somebody with both tinnitus and hearing loss, I would complete the hearing test and the tinnitus matching, and then I would do a demo a set of hearing devices. And because I knew what the frequency of their tinnitus was, I would focus on fitting that hearing aid range or hearing range and make sure we had ample gain at the tinnitus frequencies. Once we got them set and the patient was comfortable, I would ask, how's the tinnitus? They would look at me like they were listening for something, and most would say, I can only hear if I try. Very rarely was it gone at that appointment, but it was very exciting even if it was reduced. It told me that we were supplying sound at the correct frequencies. For years, patients were told mainly by their doctor that there was no cure, and they just needed to get used to it. That advice is outdated and harmful because I've seen firsthand many people get help with tinnitus, although it's a case-by-case basis. While there may not be a single cure, there are proven management strategies that dramatically reduce the tinnitus. So let's talk about these effective ones. Sound therapy is one of the cornerstones of tinnitus management, and it's the main one I used because in my practice I focused mainly on hearing aids, and many hearing aids in the past 10 years have some sort of a tinnitus masker built into them. For those who did not have hearing loss, we offered our earHero dual ear non-occluding earphones. The patient could download a sound generator app on their phone and listen to that sound that was specifically matched to their tinnitus results. The best part is that the earHero earphones don't block your ears, so you can function normally while you're listening to your tinnitus masker. I'll put a link in to some of the apps I used in my practice and the earHero earphones below. The goal of sound therapy is not to drown out tinnitus, but to reduce contrast between the tinnitus and silence. Remember, silence makes tinnitus go louder, so having a sound in the background can help you to not notice the tinnitus so much. You can use environmental sounds, fans, white noise, nature sounds, low-level background music. This is often the first step. I'm guessing you have something around the house that can make some masking sound. Years ago, there were devices that were specifically designed to create sound in the ear. They looked like a hearing aid, but they were designed just to supply the masking sound. And they were kind of bulky and they were expensive. We usually only fit them on people as a last resort. They were not super successful, but the end result was to reduce tinnitus awareness and improve their concentration and sometimes improve sleep. They work best when used consistently and not just during flare-ups. As I mentioned, they were usually expensive, so we didn't fit very many of them. And the biggest problem was that your ears were blocked while you listened, so you couldn't hear other things. That's why we developed our earHero earphones, so you could listen and still hear your surroundings at the same time. With the introduction of digital hearing aids, the manufacturers started including a tinnitus masking feature inside most of them. For people with hearing loss, this was our go-to. It was great. Many times we didn't even need to turn on the masker. If we could hit our matched frequencies with the amplification, by restoring sound input, we could reduce the tinnitus. And if we needed more help, then we still had our masker programs we could use. One of the most underutilized solutions is called habituation, which means basically brain training. Your brain learns that this sound is not important. Just like you stop noticing everyday things around you, like hum of a refrigerator, the sound of traffic, the feeling of clothes on your skin. The brain can learn to ignore tinnitus. A combination of sound therapy and habituation can help this process happen faster. Stress relief is also a critical method and often overlooked. Tinnitus is closely linked to the fight or flight system, and if your nervous system stays activated, tinnitus can stay louder. Some of the effective techniques can include slow breathing exercises, progressive muscle relaxation, guided imagery, mindfulness practices, gentle stretching, and neck relaxation. There are providers who specialize in this. It just wasn't something I did in my practice, but even 5 to 10 minutes of daily meditation can reduce tinnitus over time. There are some things that can make your tinnitus worse that you may want to avoid. Obsessively checking tinnitus, sitting in silence, constant internet searching, fear-based thinking, expecting overnight fixes. Tinnitus improves when attention and fear decrease, not when you fight it. Here's the honest truth I told patients in my practice. We want to try to reduce the tinnitus first. If we can affect it even a little bit, we have a better chance of dealing with it. The goal is not silence. The goal is less awareness, less emotional reaction, better sleep, better focus, better quality of life. And for some people, after applying some of these techniques, the tinnitus can fade into the background entirely. I know that we've covered a lot of information, so let's summarize. Number 1, tinnitus is a symptom, not a disease. 2, hearing loss is the most common cause. 3, tinnitus can be measured using tinnitus matching, which in my opinion is the first step. Sound therapy reduces contrast and retrains the brain. Using hearing aid maskers or sound generating apps with open ear earphones can help. Stress and nervous systems regulation are essential. Most people improve when given the right tools and guidance. If you're struggling with tinnitus, you need to know that you're not broken, you're not alone, and you're not out of options. The first step is to get a hearing test. And when you call for your appointment, ask the provider if they offer tinnitus matching. With the right education and the right strategy, tinnitus does not have to control your life. If you found this video helpful, hit the like and subscribe buttons so you don't miss any of my videos. It really helps so others can get this information. Don't forget to check out my links in the description below. And if you'd like me to discuss a specific topic, leave a comment below.